The hospital was closed down in March 2020 to pave way for its redevelopment due to the dilapidated nature of existing facility, which made it unsafe for both staff and patients. President Nana Addo Dankwa Akufo-Addo hence cut the salt for the commencement of construction of the large general hospital redevelopment project in August 2020, with a redevelopment scheduled to be completed in 24 months. However, the project, which is financed by a credit facility from Standard Chartered Bank of the United Kingdom, with an export credit guarantee from signed ashore of the People's Republic of China, to the tune of 68 million euros with an insurance cover of over 400 euros, has still not commenced. To this effect, the hashtag Bring Back the La General Hospital campaign was launched all over social media. Unhappy with the situation, the Member of Parliament for the Dadekotopon Constituency in the Greater Accra region, Rita Odoley Sowah, thus followed proceedings of the House by filing a question demanding to know when the construction will commence and be completed.
I wish to ask the Minister for Health when the actual construction work on the La General Hospital will begin.
Responding to the question, the Minister for Health, Kwaku Agyeman Manu, disclosed that the delay in the construction of the La General Hospital is due to the delay in insurance of the insurance cover, which have accounted for the contractor's slow progress of work, coupled with other factors.
Mr. Speaker, the project has indeed delayed due to the following challenges. 1. Following the approval of the financial agreement and the commercial contract by both Cabinet and Parliament, the guarantor, Sowah, was required to cover the project to close the transaction. Sowah delayed in the issuance of the insurance cover, which has accounted for the contractor's slow progress of work. However, the Ministry of Finance has made the necessary engagements and consultations, and it is expected that the insurance cover will be issued soon for the contractor to improve the pace of work. Second reason for the challenges for the delay, the fact that due to the condition of the land, it was critical to do an intrusive geological exploration to help determine the depth of the foundation and the sizes of the structural members for the facility. This was critical to avoid any structural problems which affected the old building and led to its demolition. Mr. Speaker, the varying waves of COVID-19 in various jurisdictions in Europe and China have also contributed to the delays. The comforting news is that once the physical construction starts with all the right drawings and studies that are currently ongoing, there will be no breaks until completion. Mr. Speaker, we will update the House on any further developments on the project.
In a follow-up question based on the Minister's answer, the said MP again sought to inquire whether necessary research was made before the President cut salt for the project.
Honourable Speaker, if I may recall, in August 2020, His Excellency the President cut salt for the commencement of the La General Hospital. And as we speak now, the Minister is telling us they have to do critical, instructive geological exploration to help determine the depth of the foundation. So does it mean that they haven't done all that and allowed His Excellency to come to Dadekotopon to cut salt and promised us that in 2 years the project will be completed?
This was the Minister's response.
Mr. Speaker, all those things were done before we sent His Excellency to do the salt cutting. But after the salt cutting, they decided to do some extra work on the place. And they realized that we still needed to do some more work.
Meanwhile, MP for Tamale North Ahassan Saibu Suhini recalled that appearing before the appointment committee, The minister told the committee that the said hospital is under construction. In view of this, he demanded to know if the cost of the project will change per his answers to the August House.
Mr. Speaker, for the reverence of your House, I just wish to put on record that the minister, when he appeared before the Appointments Committee, indicated to the nation that the hospital was under construction. And, Mr. Speaker, it is quite interesting that the answer given today is different. But my question, supplementary, relates to the second part of the answer that says, due to the condition of the land, it was critical to do an intrusive geological exploration to help determine the depth of the foundation and the sizes of the structural members for the facility. Mr. Speaker, the facility, we're told, was estimated to cost $63 million at the time that the sod was cut. With these new works that are supposed to be done, can the minister confirm to this House that the cost for the facility will not change?
Mr. Speaker, what is happening on the site now with this geological exploration is to ensure the integrity of the engineering works in there. It will be difficult for me to predict in time, within the full completion of the project, to estimate and say that there will be no change in the cost. Projects begin, and while construction is ongoing, the contractor will raise variation forms, and if you go and do an analysis and inspect, and it is good for us to accept it, we can accept to bring in changes. So for now, it will be very difficult for Mr. Speaker to estimate into the future.